Hi, I'm Dr. Kyson Frank.
And I'm Dr. Craig Farney.
We're the doctors at Docerelife Center.
But today we're here at Sedgwick County Zoo as the Doctors of Oz.
To pull back the curtain on another chronic illness.
Called
Lyme disease. So I'd like to talk to you about the expression of variants or hidden variants in the body. So when we're talking about methylation, how the body actually expresses its genome. There's certain people that have certain variants that allow them to have the potentiation to have more problems when certain stressors or certain events happen in the body. In this case, what we're talking about is when Lyme disease comes in, the toxins are being released by the Borrelia burgdorferi bacteria. Some people don't detoxify very well, and it starts to build up and create other issues, and this is where they start to have a lot of problems. Other people, they may have the Borrelia burgdorferi and they may never know they even had it because they don't experience the toxicity issues. So when we come in and we actually start looking at the genome, and we actually run a genetic test to actually look for these certain variants in your genome to kind of tell us what you may have a potentiation for having an issue. Well, we have to come back and we have to monitor changes of what we're doing with something called an OAT test, or organic acid testing. This looks at the byproducts or the outcome of certain dysfunctional pathways. So when we get these pathways working correctly, we should see these things fall back into balance. The other side of what we can do with our practice is we use kinesiology testing to actually see what different variants are actually having issues at this point in time while you're in the room, and figure out how to change that. Looking at other types of chronic infections or things like that that may be pushing or changing these different variants, and removing these stresses so you can actually methylate correctly and have your genome working for you in the best possible light. It is better for us to go through and balance out these systems, removing these hidden infections, toxins, things like this that are actually causing issues, versus just treating the symptoms of toxicity and taking binders and things like this that may give us some temporary relief, but they're not going to actually fix the pathway. So we're looking for long-term healing, long-term health, actually be able to live your best life. We have to reestablish and get these pathways working correctly for your best ability. So from your mouth to your anus is an entire long tube in your body. And understand that everything in that tube isn't technically in your body. So these parasites can live outside of your body, although they're within the tube within your body, and keep releasing toxins and keep messing with your gut lining, which affects your digestion, food allergies, all kinds of other things that can create all kinds of havoc in your body. And so being able to deal with these things properly, in conjunction with actually having to treat the Lyme disease and try to find healing, that's a big thing that we have to look at and really dive into and make sure that we clear those things out. So certain infections, or hidden infections, or stealth infections as they're called, they're very problematic. Can be anything from viruses to parasites. I usually think parasites are one of the big ones that we have to look at, because they can become infected with the Borrelia burgdorferi. They can keep releasing it back into your body. They become a safe harbor. And so by finding these things and dealing with them, it plays an important part of your healing process. I've dealt with stool tests for a long time, and I can't tell you how many times people have come back with a negative on their stool test, and yet they still start releasing worms in their stools and everything else. We start to see these things playing out. So looking at a stool test as a end-all be-all to actually ruling out whether you have parasites or not isn't a safe way of doing it, because you could overlook hidden infections that are there and not realize that those are the underlying cause, and then move on to other things. You start spinning your wheels trying to find answers. I've had a lot of patients that have come in and they've had scopes and they've had scans, they've all these things done to kind of try to find parasites, and they haven't found anything. Even imaging from MRIs to CAT scans, and they haven't found anything. They come back negative. And I'm always amazed at how they miss these things. When patients come back, 2-3 weeks later after we start treatment, they send us pictures of worms that are substantially long coming out of their bowels. So they're hidden in there somewhere, and so we've got to go in and find them. So why Lyme likes to hide in the safe harbor of parasites before it can be re-released into your body. And you often see this with patients who've had Lyme, and they get great results. They do the antibiotic route or some other route, and they start feeling really good. Life's going well for them again, and then something happens. Some stressful event happens, and all of a sudden they go back down again. Lyme flares back up, and they have remission, and so they're struggling again. So how does this happen? Why does the body allow the parasites to stay in here? Well, there's a triad we like to talk about between Lyme disease, heavy metal, and parasites. So the more heavy metals you get into your body, the greater the breeding ground you have for parasites to live there. And the body allows the parasites to stay there because it's sort of helping. It's this uneasy relationship where the parasites absorb the heavy metals and allows them to stay there. And if you kill them off too quickly, they dump all the heavy metals, which can kind of make you sick. So it's kind of like a terrorist with a time bomb on his chest. You got to be careful on how you get rid of them before they blow up and they create a lot of other issues. So dealing with this triad of things means we need to remove any of the heavy metals in our diet, in our water, in the air, smoking, any type of pollution that we're dealing with that's getting into our bodies, allowing this to become a breeding ground for these types of infections. So there's an object of patient responsibility that comes into this. As the doctor, I can only do so much. I can recommend different remedies, we can go through different spiritual things, we can deal with mental and emotional aspects, but at the end of the day, it really comes down to the patients putting in the work and really driving through there. Now I can say that because I've been through Lyme myself. I've had to go through it. I spent most of my life overcoming Lyme. Part of the reason why I became a doctor, part of the reason why I've gone down the pathways that I've gone down is because I've gotten results. When dealing with Lyme disease, sometimes there are some toxic relationships that develop with caregivers. Sometimes toxic relationship is actually with the patient themselves. They don't like to get better. They like being taken care of. They want to be the center of attention. And that develops from a young age, and they get used to that. And so that's something we have to work through. We have to go through and use neuroplasticity and other things to kind of change that pre-programming in the brain. Sometimes it's the caregiver who doesn't want to give up the responsibility of taking care of a child or another sick person, and it makes for a unique relationship, and it makes for an awkward conversation, but we'll work our way through it, and we'll help you guys get out to the other end. So in addition to all the treatments and all the things that we offer in the doctor's room, we also have many therapies we utilize in the clinic. So there's two major things that we're looking for. It's looking for detoxification and energizing the tissues that help them get better. And we have many different therapies, as you can see here, as far as what we're using. And these will really help turn the corner a little faster. And so we're really excited to offer all these things and the treatments to really get some really good results with Lyme disease. And we've had some really good success, and I've been through it myself, and so I'm very keenly aware of what you're going through.
Listen guys, we've had a lot of fun out here at the zoo, and we know that Lyme disease is a huge subject, and there's no way to cover it all. We didn't even begin to talk about things like co-infections. If you're suspecting that you or somebody you love might be dealing with Lyme's, call us. We'd love to answer any question you might have or do anything we can to help you. Guys, we want to thank you for taking the time to watch our video. I strongly encourage you to check out Macy's story. It is an incredible story of recovery. It'll bring you to tears. And I also want you to call us for a free consultation for any way that we can help improve your life, whether it be Lyme disease or any other health condition.